Hey everybody, welcome. So today I want to talk to you about a dietary approach that's been shown to improve significantly for heart health. And so we're going to be talking about many different types of meal plans, diets, and whether you want to go and lower your blood pressure or just improve your overall heart health. These would be great options to go and consider. So let's go and start. So there are some general tenets that I want you to do to go and improve your heart health. So basically, I want you to go and lower sodium, increase fiber, and lower saturated fats. So what does that mean? So basically, I want you to use a pinch of salt or to use a lot of salt. Be aware of sauces. So certain sauces can go and increase sodium and can go and increase risk of hypertension, which is high blood pressure. Increased fiber means increase like the amount of vegetables that you have. Green leafy ones are very good, or just generally using whole wheat instead of pure white or refined carbohydrates, which are like breads, uh, rice. Instead of using like white rice, use brown rice or use whole wheat bread instead of purely whole white bread. As for saturated fats, things like things like fried foods, processed foods, things like TV dinners, try to go and avoid them because those are probably going to be high in bad fats, and we don't want that, especially if you want to increase your cardiac health. So, I'm pretty sure you guys want a specific meal plan, and that's exactly what I'm going to deliver to you. So, I cannot get away without speaking about the DASH diet. So, the DASH diet is something that I actually recommend patients, and it's also something that's made to improve heart health. So what the DASH diet is it stands for Dietary Approaches to Help Stop Hypertension. Hypertension is high blood pressure, and this dietary plan helps to emphasize fruits, vegetables, whole grains, and lean proteins, while limiting saturated fats, cholesterol, and sodium. Basically, it's designed to help lower blood pressure and reduce risk of heart disease. It's not only for those who have high blood pressure. It can even help with people who have other comorbidities, basically other diseases, such as diabetes, or even if you're perfectly healthy, it's to go and help improve heart health. And that's exactly what I want to speak to you guys about. So, one thing that the DASH diet emphasizes is the consumption of fruits and vegetables. Fruits and vegetables are high in vitamins, minerals, and fiber. Try to include a variety of colorful fruits and vegetables into your diet as well. So, colorful fruits and vegetables are usually high in antioxidants. Usually, when they're different colors, they have different types of antioxidants. What antioxidants are basically compounds which help protect the body against harmful molecules, cancerogenic molecules, called free radicals. So one thing is free radicals can cause something called oxidative stress, which is linked to a variety of heart diseases, including heart disease, cancer, and neurodegenerative disorders. So antioxidants help neutralize these free radicals, and they help your body and immune system function effectively. One thing also, vitamins, minerals, those things help your body again function normally. You need vitamins, you need minerals to go and help your immune system and your body function. Fiber is basically undigestible components of food, which basically help your gut bacteria to go and feed on them. Although we don't use it for energy, it actually helps to go and helps our gut health and helps us to go and help prevent colon cancer and other types of disease as well. By having a huge amount or having a good amount of fiber, it can go and help the body function effectively as well. So as I spoke about before, try to incorporate whole grains. Whole grains such as whole wheat, oats, brown rice, and quinoa are rich in fiber and nutrients. Choose whole grain breads, cereals, and pastas over refined grains. As for protein, try to have lean proteins. So basically include lean cuts of protein. Instead of opting for that big steak, try to have lean cuts of meat. You could even include meat such as chicken and fish instead of huge amounts of steak or red meat. Try to limit your intake of red meat. And when you do eat red meat, you can opt for lean cuts when you do consume them. Try to also incorporate things like beans and legumes, chickpeas, and other ways to get protein as well. As for fat in your dairy products, try to opt for low fat dairy products, especially if you just underwent heart surgery or something like that. Such as uh, you can try to get like milk, yogurt, or cheese. Uh, these ones are also like high in protein, and make sure that like some of them aren't like creams, for example. You don't use like high fat cream, and you can reduce your intake of saturated fats and cholesterols by doing this. As for nuts, seeds, and legumes, these are foods that are rich in protein, fiber, and healthy fats. Include them in your diets as snacks or as part of your meals. Limit also saturated fats and cholesterol. So reduce the amount of saturated fats and instead uh, do this by choosing lean meats, poultry without skin, and cooking oils such that are high in unsaturated fat, such as olive oil, coconut oil, or even canola oil. So for the DASH diet regarding sodium, the DASH diet recommends to limit sodium to about 2,300 milligrams per day, or even lower to 1,500 milligrams per day for some individuals. These are usually for people who uh, have heart conditions such as heart failure, which require them to have an even lower sodium intake. As for regular people, to reduce sodium, avoid adding salt to your foods. Uh, and before you choose things that are like low sodium or sodium free, uh, choose them only like sparingly sometimes because you need certain levels of sodium. As for sweets and sugary beverages, limit your intake of sweets, sugary beverages, and foods high in added sugars as well. So, by having so much sugar in your diet too, it can also put your heart at risk. So, in summary, DASH diet is not only beneficial for heart health but also for overall health and well being. It's important to consult with a healthcare provider or registered dietitian before making any significant changes, though, to your diet. Because everybody is a little bit different, they might need different healthcare needs, and especially do so if you have any underlying health conditions. Thank you again for making it to the end of the video, and thank you so much for joining me today. Hope you have a great day and wish you the best of health to come.